everyone, I'm Natalie Kunsman, MD, and this week I had two very classic cases of anemia. And one of them was in a breastfed infant and another was in an adult menstruating female. So I thought we should talk about this. So what is anemia? Anemia is just simply a deficiency in red blood cells. Now, a side note, a deficiency in the white cells is actually called a leukemia. So the low amounts of red blood cells are a real problem because those red blood cells are what carry the oxygen to our tissues. So we have three big categories of what may cause anemia. And the first one is anemia caused by blood loss. The second one is an anemia that may be caused by a decreased or a faulty red blood cell production. And then the third category is an anemia that may be caused by destruction of red blood cells. So we'll get into all three of those. So anemia of blood loss may seem pretty obvious to us. So you can have GI causes such as ulcers that are bleeding, or hemorrhoids, or a very erosive gastritis, which is in the stomach, and then even sometimes cancer in the GI system. If there is a heavy use of NSAIDs or anti-inflammatory drugs such as Advil, Aleve, and aspirin, they can also even cause the ulcers and gastritis, which will lead to bleeding. So we also may realize that bruising and big traumas that cause a lot of bleeding into the tissue can also be a cause of the blood loss because the blood is actually not in the circulating system. A big one for us women, super common, is having periods or menstruation, especially if the bleeding is excessive. So then the second category of anemia of faulty production, one of them is actually sickle cell anemia. So the marrow is producing sickled cells, and those cells are faulty in their carrying of the oxygen throughout the system. Then we have iron deficiency anemia, such that we cannot develop cells because we don't have enough iron. There may be other vitamin deficiencies, such as B12 and sometimes D. And then there are bone marrow or stem cell problems that simply at the manufacturing site at the bone marrow do not allow the good production of red blood cells. And those are quite aggressive hematologic issues such as myelodysplastic syndrome and some other genetic related issues. Then, of course, there are other health-related issues such as kidney failure or kidney-related issues that just will not allow that bone marrow to do its job. So I want to make a special note of iron deficiency, super common. Obviously, if there is an iron-poor diet, especially in those infants or children or teens or vegans or vegetarians, this becomes a real problem. Infants do not receive a whole lot of iron because they are exclusively drinking breast milk. Now, some of the formulas may carry some iron in it. The metabolic demands of pregnancy and breastfeeding will actually deplete mom's stores of iron. Then, of course, iron deficiency will come to us menstruating females because we are frequently losing that blood, and we may not be replacing that iron that went out with the blood with supplemental iron in between those months. There are women and men with a high endurance training that are not taking in enough iron. And then there's some digestive situations such as ulcerative colitis or Crohn's disease or some of the really big inflammatory conditions that will actually lose iron throughout the day, weeks, and months. And then, of course, there are certain drugs and foods and caffeinated drinks that will deplete us of our iron. Now, as far as other losses are concerned, we can get megaloblastic anemia, which is B12 and folic acid depletion, or pernicious anemia, which is a poor B12 absorption related issue. So we can lose iron and we can eat little or do not replace our losses with those vitamins. Medications, alcohol abuse, intestinal disorders like we described can also prevent the good absorption of that vitamin vehicle to help manufacture red blood cells. Now, aplastic anemia, quick note about that. That's when there's a marked reduction in the stem cells or an absence of these cells, and some of that can be related to comorbid conditions. Some of it can relate to genetic related issues or radiation, and a big one, which is chemotherapy or catastrophic infections. Thalassemia is a genetic trait where the red blood cells just don't grow and mature properly, and that may happen in some Mediterranean, African, Middle Eastern, and some Southeast Asian patients. Lead exposure is toxic to the bone marrow, which will lead to fewer red blood cells. And some of us may realize that there are work-related exposures for lead and improper glazing with potteries and liquids that may cause that as well. Category number 2, anemia from destruction, I should say, maybe 3, category number 3. There are inherited conditions such as the sickle cell and thalassemia, and if the body perceives abnormal red blood cells, the spleen will take them and try to destroy them in hopes that there will be normal ones produced in their place. There are stressors such as infections and drugs and snake and spider venom and certain foods that may destroy the red blood cell. Now, there are toxins that get released in advanced liver or kidney disease, and unfortunately, that also will break down red blood cells. So there are a few inappropriate attacks by the immune system, such as hemolytic disease of the newborn, and those are rare related issues, but there are some common issues such as our vascular grafts, prosthetic heart valves, tumors, severe burns, chemicals, and, believe it or not, hypertension and clotting disorders, which will break down those red blood cells. And if there are spleen related issues, the spleen can trap those red blood cells and destroy them without allowing them to recirculate and get enough replacements. So those were the 3 main categories that cause anemia. So what does an anemic patient look like? Well, to me, that's pretty obvious to see because they are pale, tired, short of breath. They may be having some chest pain with their exertion or at rest. Lots and lots of joint pain, especially in the sickle cell patient, because those joints aren't receiving enough blood flow. They may be foggy. They may have a mood disturbance, which is typically depressive, sometimes anxiety-based. They may have pica, which is an unusual preponderance to want non-food items. Ice chips are number 1, and powdered substances are probably the next big category. Anemic patients are thirsty. They have poor workout stamina. They may be dizzy, and here's the obvious one. They may be complaining of bleeding excessively or black poop, which is indicating blood in the stool. So how do we diagnose this? Well, it's so easy with a simple blood test. So that may peel the onion on the outer layer to determine that they are anemic. But then you are looking for potentially more blood work, looking at iron deficiencies, iron storage capacity that's low. We may actually need to go looking for the sources of bleeding that require more tests scopes, and potentially specialists. And of course, the treatment is heavily dependent upon the mechanism of the anemia. So we may have to repair the deficiencies, and most times an oral regimen may improve this. However, there are some people that don't absorb well enough, or their GI systems are poor enough that they may need IV therapy, such as IV iron infusions. And sometimes blood itself needs to be replenished. Sometimes we need to cauterize or find the bleeding source. And for some of us women, there can be a hormonal approach to balance that hormone loss and heavy menses. And there can be laser, such as ablations, a DNC, or in really extreme cases, maybe even a hysterectomy is needed. But going after that is paramount. Now, disorders of destruction that might be chemical burns and valves and autoimmune-based issues and genetic treatments, they are much trickier, but we do have ways to go about that. And your friendly family physician will always be voting for preventive ways to keep up your stores, which is a healthy diet with leafy greens and decent meat sources. Again, I'm Natalie Kunsman, MD. Anemia was the topic for today. Please leave any questions you may have below. Subscribe to my channel, and until we meet again, be well.